Hi everybody. Today I'm going to talk about sacroiliac joint pain, a very common cause of low back pain and also a very commonly overlooked cause of low back pain. So what is the SI joint? The SI joint or the sacroiliac joint is the joint that the sacrum makes with the pelvis. It's a fairly large joint, very common cause of back pain. In fact, 8 to 10% of the people who are suffering with low back pain have pain related to the SI joint. Sacroiliac joint pain could affect one side or both sides at the same time. People with leg length discrepancy, any kind of lower extremity surgery, any gait abnormalities, previous pregnancy or delivery may predispose you to developing sacroiliac joint pain. It usually presents as a sharp stabbing back pain that's located in the lower part of the back, oftentimes mistaken with a lumbar problem. But in fact, the SI joint could be the driver of this pain. Oftentimes, it may radiate into the thigh area, which confuses this diagnosis with the sciatica type pain. The pain from the SI joint could also radiate into the groin area, which may sometimes confuse this with a hip problem. So this joint can masquerade as several different things, and the best way to both diagnose and potentially treat pain related to the sacroiliac joint is to do an ultrasound or X-ray guided sacroiliac joint injection, an injection of local anesthetic, oftentimes mixed with some steroid, right into the SI joint, helps determine if in fact the pain is being driven by this joint. If someone experiences extremely good quality pain relief when we do this injection, that also helps confirm the diagnosis. Sometimes an injection is all it takes to decrease the inflammation and provide months and months of relief. But if someone experiences very good quality relief from injections of steroid or local anesthetic, but it is short term, then there are other definitive treatment options to follow this with. So what are the long-term treatment options for sacroiliac joint pain? One option is a very minimally invasive approach for a fusion of the SI joint. There are several ways to accomplish that fusion depending on your doctor, your patient factors, as well as physician factors. We may decide to choose one approach over the other, but it is a very good way of minimizing that micromotion from happening at the sacroiliac joint, decrease inflammation, and fuse it so that it becomes less painful and in fact not painful over a period of time. Another option is to utilize regenerative medicine-based treatments such as platelet-rich plasma, which is your own blood product which is injected into the SI joint and can help repair or heal some of the tissue and the synovial membrane and lining of the SI joint to provide more sustained relief. So, if you're dealing with low back pain that sounds like it could be sacroiliac joint, make an appointment with us at Texas Pain Intervention Clinic. We'll do diagnostic imaging, injections to both diagnose and treat this complex problem.